series is intended for EAP providers that wish to integrate SBIRT into their practice. It offers practical suggestions and demonstrations for each step of the SBIRT process, including the pre-screen, audit, brief intervention, and referral to treatment. Motivational enhancement techniques are used throughout each interview, including open-ended questions, affirmations, reflections, summaries, asking permission to provide feedback, eliciting change talk, and listening for change talk. These techniques are displayed as they are used throughout each interview. The pre-screen for substance use and depression is administered as part of the intake interview. These questions can be asked in person or over the phone. If the client answers yes to either current tobacco use or drug use in the past 12 months, or reports having more than 3 drinks for women or 4 drinks for men in the past 90 days, this is a positive screen for risky substance use. If the client answers yes to either depression screening question, this is a positive screen for depression. A positive screen for risky substance use or depression indicates a need for further assessment and a possible referral to specialized services.
All right, Steve, I have a few more questions for you. I'm now going to ask you a few questions about tobacco, alcohol, and other drugs. These are routine questions and they're intended to help us gain a full picture of each client's life. Just as with all of the other questions, your answers will be kept completely confidential.
Well, I don't think I have any problems with any of that. I'm just worried about work.
I understand you're concerned mostly about work. Sometimes substances, including alcohol, play a role in the health, social, legal, and financial issues our clients face. Would it be all right if I asked you a few questions about that?
Yeah, I guess that's okay, but I really don't have a problem with it.
Okay, well, thank you for being open to answering these questions. Do you currently smoke or use any form of tobacco?
No, I quit 2 years ago.
Congratulations. It can be difficult to quit smoking a lot of the time. The next question I have for you is, when was the last time you had more than 4 drinks in one day?
Let's see. That was probably Sunday night. I had about 4 beers and 2 shots. Probably about 6 drinks that night.
Okay, so on Saturday you had 6 drinks. How many drinks do you have typically in a week?
Well, I like to unwind on the weekends. Like I said, I usually have a few beers and maybe a couple of shots if I'm really having a good time. Probably go out every Friday and Saturday. So if I have maybe 6 drinks each of those days, I'd say maybe I have 12 drinks a week.
All right, so you'd say you have about 12 drinks per week.
Yeah, that's right.
Okay. In the past 12 months, have you used drugs other than those required for medical reasons?
No, I have a prescription, but I don't do drugs.
So you don't use any drugs other than those needed for medical purposes. All right, I just have a few more questions for you. Over the past 2 weeks, have you felt down, depressed, or hopeless?
Sure. I mean, I've felt down. I'd say yes. Things haven't really been going so well for me.
You felt down because things aren't going the way you'd like them to right now.
That's right.
Okay. Over the past 2 weeks, have you felt little interest or pleasure in doing things?
Yeah, things have just been rough. It's been hard to concentrate on important things.
It does sound like things have been difficult for you lately. All of this information will help us assess your needs most appropriately and achieve the best outcomes. Thank you for being open and honest with me today.
No problem.
This client screened positive for both the substance use and depression screens. These positive screens indicate a need for further assessment and a possible referral to treatment.